Winning the battle against AIDS, the latest report by the UN shows a remarkable drop in HIV infections in many parts of the world. What's behind the progress, and could AIDS one day be beaten? This is Inside Story. Hello and a very warm welcome to the programme. I'm Jane Dutton. The world is closing in on its stated goal to end the AIDS epidemic. According to the latest UNAIDS report released Wednesday, much progress has been made in the last 3 years. It shows there were 2.3 million new HIV infections in 2012. That's down from 2.7 million in 2010. It is the lowest number since the peak of the epidemic in the late 1990s, when there were 3.5 million new cases a year. The latest drop has been most noticeable among children. In 2001, more than 500,000 new cases were recorded. Last year, that figure had dropped by half to some 260,000. Overall, the number of AIDS-related deaths has dropped from a high of 2.3 million in 2005 to 1.6 million in 2012. A significant achievement, but still well short of the UN vision of zero new HIV infections and zero AIDS-related deaths. So what has been the cause for this drop in new cases of HIV/AIDS? Well, first of all, it is the cost. Antiretroviral therapy for 1 year used to cost $10,000 per person in the mid-1990s. Last year, the annual cost dropped to just $140 per person. This has further been helped by an increased commitment by politicians and further advances in science. Well, for more on this rather exciting news, I'm joined by guests from Geneva, Dr. Luiz Loures, Deputy Executive Director of Programme for UNAIDS, and from Beirut, Elie Aaraj, President of the Regional Arab Network Against AIDS. Gentlemen, welcome. Thank you very much for joining us on Inside Story. Luiz, interesting reading, and I know you contributed to this report as a doctor. Good news in many parts of the world. Tell us more about your findings and what really stood out for you.
Great progress in many parts of the world, there is no question. We are, for the first time, I think, start to have the end of AIDS on site. There are more people under treatment than ever before. More than 10 million people are being treated today, compared to almost zero in the developing country at the beginning of the century. Infections are coming down, mainly in the most affected countries. But we have a risk today of continue to advance in leaving people and the regions behind. Regions like Eastern Europe, like the Middle East, and the people that belong, for instance, to key populations to the epidemic today, like sex workers, like homosexual men, like migrants, and you go, and the other populations. Of particular importance, I would mention that there is a risk that children will be left behind of the journey towards progress and towards the end of AIDS. Children are getting less treatment compared to adults. Only 3 children out of 10.
Why is that? Why do they get less treatment
today to HIV? I think there is a combination of factors that are working there. I think there is not sufficient focus and attention to the epidemic among children. We lack technology and instruments to treat children adequately, like, for instance, the formulations that we have today, they are still not the best to treat children. It's very difficult to a small guy to take a big pill every day or take several pills. We need to have formulations that are more adapted to the size of who you are talking about here. Too often, we are basically overlooking the epidemic among children. It's like we have unbalanced progress. We are doing well in several fronts, but we need to make sure that we don't leave children behind.
As you say, I mean, that seems to be an obvious one, considering they are our future. So maybe that will be one of the outcomes of this report. Elie, what did you make of the report, and does it ring true in your work in your region?
In this situation, we cannot but applauding the efforts done by UNAIDS and other UN agencies, including also some governments. Our main concern is that this is for the third year that MENA region, the Middle East and North African region, is becoming has the highest increase of new contaminated and registered persons. So this is our fear because we are trying to keep the prevalence very low, and we are trying to keep it low as well in some of the key populations. But our problem is that in this region we have a lowest coverage of treatment and healthcare services related to HIV, and this is also another burden on the society and the government's economical burden. But it is
what do you mean by the lowest coverage?
So,
excuse me, jumping in here. Are you saying that it's something that's not possibly been taken seriously, or there's not enough initiatives around to?
No, it's also some it's related to some factors. One of them is the economic situation. The other is that HIV is still not at the priority of the government's agendas. There is another factor also that is related to the donors from the international society. And here the donors can say that, they usually said that MENA region has rich countries and it's at a low prevalence. Now the figures show us that we are at a high risk for not continuing to be at the low prevalence, especially that we don't know our epidemic in MENA region. We don't have a good surveillance system in the countries. And when they say we have a rich country, yes, we have some rich countries, but in our rich countries we can find at least 20% of people who are living under the threshold of the poverty, which is very bad for them, which is very risky. There is another new factor, emerging factor in the region. You know, the instability, the security problem in some countries that led to the refugees camps and the refugee situation. And here also there is a big need to go and stress the point on these groups. Women, of course, women and their need to be. Lately, we conducted an operational study in 6 countries of the region on women who inject drugs, and here I can tell you that we witness currently of a big evidence of needs and precarity where people are living, and there is a big need for services, for care services, but also for prevention and harm reduction services.
And I should imagine it's really difficult as well with the, excuse me, jumping in here, the economic downturn and the fact that you've got so many refugees and people are depressed, and that could possibly lead to the increase in drugs. And I guess the problem with using drugs is that possibly you don't look out for cleanliness.
Yeah, there is. We had last week. We had a regional conference on harm reduction with the Middle East and North Africa Harm Reduction Association, and all experts who came. We had around 225 persons coming from 24 countries. All of them, they talked about the increase of use of drugs and the availability of drugs in the countries sometimes at a very, very low cost, which is very important. The use of the syringes and the syringe sharing in the region is very high. I can tell you that although until now we are at a low prevalence of HIV, we know that it is low in the general population, but we have evidence that there is a concentrated epidemic among especially injecting drug users and men who have sex with men, which is very important. I can tell you also that the restrictive laws in the countries are, and the level of stigma and discrimination are burdening people living with HIV and key population. They are preventing them from seeking services and putting them at a high risk, which is very, very, very important for us.
Okay, you raised a lot of issues there. Let me just throw some of them to Luiz. I mean, I suppose one of the problems is that if it plagues only certain groups, does it then take away the incentive of the government to possibly deal with those groups? Do people then think, oh, it's somebody else's problem, so I'm not too concerned?
This is a societal issue. AIDS, and we have learned that during 30 years of epidemic, is an issue that concerns the whole society. There is no barriers to the virus geographically or regarding certain populations groups only. The experience and the history has shown that AIDS, if not taken as a societal issue, will be always a threat to everybody. There is no restriction. And let me give you one example. As has been mentioned by my colleague, the situation in the MENA region, in the Middle East today, in relation to recent change in social organization. You see, for instance, the epidemic in Libya today is one of the epidemics globally that I'm more concerned about. It's growing fast. It's growing bringing major difficulties to the country to respond to it. That's related to several factors, but it's there. And we may see situations like that in other countries as mainly as security becoming an issue. There is a clear relationship, and that's clear for us, that when security becomes an issue, AIDS may come after. When countries have less control of its own borders, and so AIDS may become an issue.
Okay. And what about new epidemics? Are you seeing new epidemics?
Yes.
In the sense that they take on their own life form and their own trajectory?
Yes, they change. They change according to the societal dynamics. You know, the epidemic in Libya, until a few years ago, was at least not even closer to what we see today. Change and new epidemics emerge as we change the way that we behave, the way that societies get organized or not. If there is less security, the epidemic may come in a different way. If there is more economic development in some situations, you have more money, more men, and that is followed by more work on sex, by more availability of paid sex, and that usually also open the door to HIV/AIDS. It's not. It is a false sense to think that the AIDS and HIV will be always restricted to some groups or some regions in the world.
So it was interesting that a little bit earlier you were rather confident, excuse me jumping in here, you're rather confident, but actually if you absorb what you're saying, then it's something that possibly will never be stamped out, because there's so many conditions that make this HIV epidemic ripe.
Depends on how you take. You have examples of very important challenges like South Africa. South Africa probably was facing, until a few years ago, the biggest challenge globally in terms of the AIDS epidemic. They are reverting. They are turning the tide. South Africa is treating more people today than any other country in the world. South Africa is bringing epidemics down. South Africa is testing more people than any other country in the world. South Africa, to me, is the best example that even if the challenge is big, it's possible to change.
But they also had to change their thought process, didn't they? Because, I mean, initially, especially under Thabo Mbeki's leadership, there was a denial that HIV led to AIDS. Elie, in your region, is denial an important factor here when it comes to dealing with AIDS, and that possibly it's quite a conservative society, so people don't want to talk about it? Again, that word stigma pops up.
Yes, sure. The denial is one of the factors of increasing of this disease. I can tell you that it's not only at the individual level or at the societal level. It's also at the governmental level. Some of our governments do not want to declare the new infected number of their countries. They don't want to declare the
Why not?
The prevalence.
Is it a financial issue?
No, I think it's more related to the taboo that HIV is related to sexual relationships and to drug use and other kind of sexual behavior. So this is the big issue. When we go and try to advocate with some of our governments, the first thing they said, don't ask us about numbers. This is a big problem.
Extraordinary.
This is why we say that we need to break the silence. We need to let people talk openly about that. Not only those who have HIV, but also the general population should be aware about this. There is also the religious factor in some countries as well. When you say HIV and injecting drug use, or men who have sex with men, or sex work, or even heterosexual relationship, this is not allowed by the religion nor by the laws. And some responsible in the countries, some official people, they don't want to see that we have this in our countries.
And if you don't talk about it, I guess they feel that it doesn't exist. So I'm going to just jump in here. I want to quickly give a précis of what we're talking about and take a closer look at HIV around the world, where it has dropped and where it's actually on the rise. In sub-Saharan Africa, 1 million fewer people contracted HIV in 2012. That's a drop of almost 40%. In Latin America, there were 11,000 fewer people who were infected by HIV. That's an 11% drop. And in the Caribbean, the number of new HIV cases fell by more than 50% since 2011. But that wasn't the case in the Middle East and North Africa, as we have been discussing, where the number of people thought to have been infected by HIV rose by more than 50%. Louis, tell me about the laws that affect people living with HIV. Obviously, they differ from country to country, but how effective you think they are?
Depends on the law you are talking about. If you are talking about laws that criminalize people that are under risk of acquiring HIV, as for instance, men that have sex with men, it was referred before, or sex workers, or migrants, these laws only make these people going underground and not to access the prevention and the treatment services. Do not help. In terms of, does not protect the society. In contrary of that, that makes prevention and treatment much more difficult. You cannot reach people that are under constant risk of being criminalized because of sexual orientation, for instance.
So what do you think the law should be? Should it just rather affect or be restricted to those who willingly infect people or don't tell people that they have got HIV/AIDS?
That's a different story. I think you need to take case by case. But the laws, if you want a legislative framework, a legislation that help to control, help to address the AIDS epidemic, these laws should be basically protective. They should be conducive for people to reach health service. They should be laws that make health of universal access. They should be laws that make treatment mandatory for anyone that has HIV, independent of who they are. These are the kind of laws that we learn with history that's possible to respond to AIDS. The situation today, as we are alluding, is like we live two worlds. We live one world, one part of the world that is showing that's possible despite of the challenge to respond to AIDS, with a combination of legislation, as you said, of political commitment, of money, and of course, of social mobilization. This combination, we have learned that if you combine this to science, you can beat this epidemic. But there is another word, there is another part that is still challenging us, is still holding us back. And you make the reference to the region specifically of the Middle East and North Africa. But what I'm trying to say, that despite the challenge, it's possible to make it. More and more, the rest of the world is showing to us that it's possible to control, it's possible to respond to the AIDS epidemic.
But it's always possible, it seems, from taking what you said earlier on, and let me just throw this to you, Elie. It's possible if the government gets involved, it's possible if there's education, and it's possible if you have access to these drugs, which make a dramatic impact.
Yeah, sure. It should be a joint effort. But let me tell you also, when we talk about laws, I think also we should be sure that laws are not only made to be only to punish people. They should be made also to work on inclusion. And here, when we talk about laws, also we need to understand that if we are talking about the rights of people living with HIV or of the key populations that are restricted by the law, we are talking about human rights in general, and we are talking about also the inclusion of people in the society, not to exclude them out of the society, and especially that they have the right to access to services. This is why we need all the efforts: education, to fight stigma and discrimination, and to understand what is HIV and how to fight HIV.
Yes, is that
governments to...
excuse me interrupting, Elie. Is that key here,
Sorry?
understanding what HIV is? I mean, the fact that you can't catch it from just talking to somebody or just touching somebody. Not everybody knows that.
Yeah, we should join our effort, because now we're talking 32 years of HIV life, and we are still facing in some situation or in some countries or cities, people who do not know anything about HIV. This is the problem. It should be included in the education. Sexual education should be included in the curricula of the schools, and at home, even also at the churches or the mosques. This is the issue. I said it's a joint effort. I mean that we need all to work on that. Now, people may say that we are a little bit saying that we have a problem. We don't want to face a problem. We are trying to prevent our countries and the region from having a big problem, like we have seen in other regions in the world.
Sure.
So this is why I said we are in an alarming situation.
Luiz, what do you make about, you did talk about South Africa and how they've been able to turn the tide. What do you make of circumcision? It's a very big thing in South Africa. It's been going for a couple of years now. Obviously, it's not nothing that you should try at home. But how effective is that? And is that something that you could take to other countries?
It's big in South Africa. It's growing. In Africa, circumcision is a key tool in terms of preventing more infections, mainly in terms of what we call generalized epidemics, like we see in most of sub-Saharan Africa. But always, as I said before, we should always look for a combination of tools, a combination of interventions that bring the science, what we know that may work, what we know work for sure, like, for instance, circumcision, like availability of condoms, like the prophylactic when you prevent the transmission from the mother to the child. We need to apply all of that. But for science to work, we need to have an environment, a social environment that's conducive. And this is exactly the point that you are talking here. The Middle East and North Africa, again, they have all the elements to turn the tide as well. The science is in favor, money is made available, but we need to work further in terms of have an environment that you allow science to work, you allow people to access what we know together, and really to have a movement that can turn the tide also in South Africa, in North Africa, and also in the Middle East.
Elie, very briefly from you, if you don't mind, it must be very frustrating knowing that in this day and age there's no need for anybody anymore to die from AIDS.
Yeah, I agree that nobody should die from HIV. Nobody should be away from the services and from the treatment. UNAIDS launched an initiative saying treatment is prevention. Yes, treatment is prevention. Until now, we are at the lowest coverage worldwide in the MENA region. There is a lack of commitment from our countries, but also from our some of the donors, because we need to show that there is a big problem here. We have people who are dying, and we have an increase in the prevalence, and this cannot be continued this way.
Well, gentlemen, we're going to have to leave it there. It's been very interesting getting your thoughts on this. Luiz Loures and Elie Aaraj, thank you. And thank you for joining us on this edition of Inside Story. If you want, you can send us your feedback. Just email your thoughts to us at insidestory@aljazeera.net. Thanks very much for watching.